Hello everyone. Do you know that nearly 12 to 15 million people worldwide suffer from stroke every year and more than 80% of brain strokes can be prevented? So what is a brain stroke? It is an abrupt onset or sudden onset focal neurological deficit, which means localized loss of function like right arm weakness or blurry vision, which lasts for more than 24 hours and is always due to a vascular event or cause. Now, some key points to remember. First, brain consumes about 20% of the body's total oxygen. Brain is extremely sensitive to changes in oxygen supply. Irreversible damage of the neurons begins at 5 minutes of hypoxia. Hypoxia means oxygen deficiency at the tissue level. The most vulnerable areas to hypoxia are hippocampus, neocortex, Purkinje cells of cerebellum, and also the watershed areas of the brain. Now, brain stroke can be majorly divided into ischemic stroke and hemorrhagic stroke. Now, ischemic stroke, which is the most common one, it accounts for about 87% of the cases. Here, there is a blockage in the artery supplying blood to the brain, thereby depriving the brain of oxygen and nutrients. Now, it can be further divided into embolic, thrombotic, and hypoxic types. Now please look at the picture. In this picture, we can see that there is a blood clot formation usually due to atherosclerosis and there is a cholesterol plaque formation. Now, this narrows down the path of the artery, thereby not allowing enough blood to pass through it. Now, hemorrhagic stroke, it happens when a weak blood vessel in the brain ruptures and bleeds into the surrounding area and the spaces. Now, it can cause two effects. Number one, the cells downstream from the area of the bleed will not get enough oxygen and blood supply. Number two, the leaking blood will accumulate in the brain and will cause high pressure. Now, this hemorrhagic stroke can be again divided into intracerebral hemorrhage and subarachnoid hemorrhage. What is intracerebral hemorrhage? It is the bleeding directly into the brain tissue. It is the most common type and is usually caused by long term, uncontrolled high blood pressure. Whereas subarachnoid hemorrhage is the bleeding between the brain and the meningeal layers. This is often caused by brain aneurysm ruptured or arteriovenous malformation, and this is famously described by patients as worst headache of my life. Now there can be other types of brain stroke too, like TIA, which is Transient Ischemic Attack, and also brainstem strokes. Brainstem strokes. Now, how does stroke happens? First, in embolic ischemic stroke, a blood clot is formed, as usual, by RBCs, platelets, and fibrin mesh. Now, this blood clot can either form in the arteries itself or it can form in some other organs, like heart in case of atrial fibrillation. Now, this blood clot might break off and get swept away along with the blood flow. When this clot reaches the narrow vessels, it might get stuck or lodged, thereby stopping the blood flow thereafter. In thrombotic ischemic stroke, high blood pressure, cholesterol, or smoking causes these fatty plaques to build up in the arterial wall. Now, this plaque can become unstable and can crack or rupture. Now, body senses this and it's an injury, and platelets are rushed in to help to the site. Now, a fibrin mesh is formed over here. With time, this actually forms a secondary clot. Now, this clot will eventually block the blood flow to the downstream, and this will deprive the brain of essential nutrients and oxygen. Now, before we proceed further, let's talk about the blood supply of brain in short. We know that brain is supplied by the branches of internal carotid artery and the vertebral artery. Now, the branches of internal carotid artery like the anterior cerebral artery and the middle cerebral artery supplies the anterior compartment like the frontal lobe, the parietal lobe and most of the temporal lobes. Whereas these two vertebral arteries join together to form the basilar artery. Now, a point to note here is this posterior cerebral artery is a branch of basilar artery and not internal carotid artery. Now, these branches of basilar artery supply the posterior compartment like the occipital lobe, the cerebellum, the brainstem. Now, at the base of the brain, these two systems join together to form the Circle of Willis. Why? Because if the one of the major arteries gets blocked, then blood can flow from the long way round from the other side to prevent a stroke. Now, anterior cerebral artery stroke can lead to leg and foot weakness. Middle cerebral artery stroke can lead to face and arm weakness, speech problems, and posterior cerebral artery stroke can lead to visual field defects. Now, the risk factors for stroke can be divided into non-modifiable factors and modifiable factors. Modifiable factors means we can change them. Now, first, non-modifiable factors, we have age. More is the age, more is the risk. Gender, men have more risk. Race, ethnicity, family history of stroke, and also personal history of any vascular events like myocardial infarction and pulmonary embolism. Then modifiable factors, so we have high blood pressure, high cholesterol, lack of exercise, obesity or weight gain, cardiac diseases, diabetes, stress, smoking and heavy alcohol drinking. Now remember, to recognize the warning signs of a stroke, we have to be fast. So what is be fast? B is for balance, means we have to notice if the person is having difficulty in standing up or he is losing his balance. A is for eyes, blurry vision, double vision, or if there is loss of vision. F is for face, means if the face is drooping on any of the side. A is for arms and legs, means if there is sudden weakness or loss of power in any of the limbs. S is for speech, means if the patient is having difficulty in speaking or communicating. T means it's time to call the emergency services or ambulance and the patient should be immediately taken to the hospital. Next is TIA or Transient Ischemic Attack. Now, this is a brief interruption of the blood flow to an area of the brain. It leads to reversible neurological signs and it lasts for less than 24 hours. So, the key points to note are reversible and less than 24 hours. It is actually a very serious warning for future stroke. ABCD2 scoring is a clinical tool which is used to assess the risk of stroke in a patient of TIA. And if you want to know more about strokes, then please stay tuned for my upcoming videos where I will talk in detail about each type of stroke. And please do comment what you would like to know next. And please support my channel and subscribe to my channel. And have a nice day. Thank you. Bye-bye.